Okay, so I'm going to get started. Hello, everyone. My name is Ryan Daniels, and welcome to the Melanoma Research Foundation's Ask the Expert series. Again, my name's Ryan. I'm the Education Program Coordinator for the Rare Subtypes at the Melanoma Research Foundation. We are pleased to have you join us this evening for this wonderful educational opportunity entitled Finding Support in the Adolescent and Young Adult Melanoma Community. The focus of this webinar is to offer valuable insights into finding support, accessing resources, and the unique experiences of adolescents and young adults affected by melanoma. We will also hear from a patient who has been so kind to share her story, and we will be sure to leave some time for questions at the end. So I just wanted to share a little bit about the MRF. Our mission is to eradicate melanoma by accelerating research while educating to and advocating for the melanoma community. We know that education is critical for patients to make informed decisions about their care, and we're so grateful for our speakers for joining us this evening. Just a bit of housekeeping before we get started. We encourage you to use the Q&A box to ask questions throughout the session. The information presented during today's session is for educational purposes, and any individual treatment questions should be directed to your healthcare provider. We encourage everyone to visit melanoma.org to learn more about the resources we have available. Also, this session will be available for viewing later as part of our videos on demand library that you can share with others or rewatch later. And so with that being said, we're going to go ahead and get started with our first speaker, Dr. Kelly Nelson. I will be sure to introduce her. Dr. Nelson is an associate professor of dermatology with the University of Texas MD Anderson Cancer Center, where she leads the early melanoma detection research team. Her research seeks to reduce melanoma diagnostic disparities in areas of Texas with no dermatologists and combines geospatial imaging, educational theory approaches, and image annotation to support machine learning diagnosis. She also serves as the associate medical director of the Melanoma and Skin Clinic at MD Anderson. We're honored to have you join us, Dr. Nelson.
Thank you. It's such a pleasure to be with you all, and I'm really looking forward to this session. And it's a privilege to get to share any thoughts that I have in this space with you all. Okay, so when we think about adolescent and young adults in healthcare in general, this grouping is usually defined as patients aged 15 to 39. And there's a lot of diversity in that age range. And so within that AYA cohort, there can be even further divisions by age that are usually grouped as you see here. And it makes sense in terms of where people are with their sort of life evolution and their just generally what's going on with their care. What's really important and has been looked at much more over the past, I'd say 5 to 8 years, is the concept that patients in these age ranges have different cancer care needs than children or pediatric patients who are age 14 and younger, and full-blown grown-ups who are age 40 and older. And specifically, the differences include the risk of specific cancers is different, their representation in clinical trials is different, and their survivorship needs are very different. And when we look within AYA patients who have cancer compared to their peers, we can see other differences beyond their cancer. So AYA patients who have had cancer tend to have a higher prevalence of smoking, of chronic health issues, and just mental, physical health challenges that mean that they have special needs when we look at taking care of not only their cancer, but their long-term health trajectory as they move into being adults. A specific area where there's even less data is around sexual gender minority patients and cancer outcomes. So when we look at all cancer patients and we compare those who are sexual gender minority to those who aren't, patients who are sexual gender minority have worse cancer outcomes globally. When you then look at patients who are both AYA and sexual gender minority, that's a group where we need a lot of research to better understand how to meet their needs and make sure they have trust in the healthcare system and can get the care that they need. So what are the things that AYA patients with cancer face? They have specific challenges with getting diagnostic care, getting the right treatment, making sure that they're getting the right surveillance and survivorship care, navigating relationships, not only with the people who they already know, which are going to be their friends and their family once they're faced with a cancer diagnosis, but then also with making new relationships with either friends or potential romantic interests. They have a lot of backstory that most patients their age don't even have to worry about. When do you trust someone enough to share these parts of your journey? And then balancing school and work with all of the medical demands that they may have. It's a completely different source of stress and challenge than what most of their peers face. So moving now from the AYA space in general to melanoma, when we think about melanoma, the spaces for pediatric melanoma that occurs before puberty, that's pretty well defined. It's much more well defined now than it was 15 years ago. And then when we think about grown-up melanoma, that's also well defined. What's less well defined is what does melanoma look like for AYA patients? What are the hallmarks that patients need to get a diagnostic examination and biopsy? That space is not very well defined. Within the pediatric melanoma, we have a completely different set of ABCDE criteria for children who have a growing nodule that needs to be evaluated that could be melanoma. And then a completely different set of ABCDE criteria for grown-ups. And we really don't have anything like that for AYA patients, and trying to make sure that they get the appropriate diagnostic care and the detection of their melanoma at early stages. When we look at AYA patients as a whole and what is the sort of distribution of cancers across this age group, melanoma is one of the top 3 most common AYA cancers. When we look at AYA melanoma compared to grown-up melanoma and trying to understand what we know and what we don't know, it seems that patients who are diagnosed with melanoma when they're in this age range may have different driving mutations in their melanomas themselves. We don't know a whole lot about their inherited genetics, the genetics that can be passed from one generation to the next, what's sometimes called germline mutations. And then their outcomes and their survivorship needs. When we look at the big trials that are trying to find new treatments for melanoma, AYA patients are underrepresented in those trials. And so when you're trying to tease out what's the best treatment for this patient with advanced melanoma, there's a data gap to really understand what are the best treatments that patients in this age group should be offered. They may be very different than the best treatment options for someone who's in their early 70s with locally advanced disease. But we don't really have the participation in clinical trials to be able to answer those questions. And then similarly with survivorship needs, someone who's diagnosed with melanoma when they're 19, we're looking at potentially having 70 years of following them to make sure that if they do make a second melanoma, we're going to detect it early and diagnose it earlier than their first primary tumor. Someone who's in their 70s when they're diagnosed, it's a very different timeline for following them and making sure that we have enough surveillance to detect their melanoma while also not unnecessarily biopsying things that don't need to be removed. So that's my super quick 30,000-foot overview of the AYA space as it pertains to cancer and melanoma. I'm going to stop sharing. Jen's going to share her story. And then after she has a chance to share her story, she and I are going to talk together about some of the themes that her story highlights regarding AYA melanoma and what we still need to explore with research to better understand how to help our patients.
So I will introduce Jenn. She is a melanoma survivor and patient advocate, Jenn Routt. Jenn lives in the San Francisco Bay Area at age 28. She was originally diagnosed with stage 3 melanoma And after a year of adjuvant immunotherapy treatment, she had a recurrence, which put her at stage 4. She then went on the combination of Yervo and Opdivo for another year. At the end of the second year of infusions, she had surgery to remove the last stubborn tumor, and she's been dead for almost 7 years. During the early days, right after her diagnosis, she came across the MRF's website and patient forum. That's where she found a community that truly helped her understand melanoma and made her feel a lot less alone. She's continued to share her story as often as possible in the hopes that it will help young adults understand the importance of skin checks, advocating for their health, and that being young does not exclude them from a diagnosis like melanoma. Jen, I want to thank you for being here this evening.
Thank you, Ryan. I appreciate it. Hello, everybody. Good evening. I first really want to thank the Melanoma Research Foundation for inviting me to speak here tonight and to share my story. As Ryan mentioned, I've been sharing my story as often as I can since my diagnosis in the hopes that it can help any young adult realize that they're not free from this type of diagnosis and also that they're not alone if they find themselves going through it themselves. I'm going to share a bit about my journey from a misdiagnosis to eventual diagnosis, what support I found along the way, and what I learned through the process. So in 2015, at age 28, I noticed a small new spot on my lower leg. It kind of looked like a bug bite, and after about a month, it didn't go away. It kept getting a little bigger. So I sent a photo to my primary care provider, and she had me come in for a visit. She took a quick look. Within a few minutes, she misdiagnosed the spot as a benign skin lesion called a seborrheic keratosis. I had full trust in her, so I was relieved it was not something to worry about, and I went on with my life. 6 months later, the spot had nearly tripled in size. It was itchy, bleeding, and uncomfortable. I also ended up having a mysterious black area show up on one of my toenails that had me concerned, so I decided to go back to my PCP, have my toe looked at, and also ask for the ugly spot on my leg to be removed. At this point, I was more concerned about the weird area on my toenail and not concerned about the changing spot on my leg, since I still had trust that my PCP was correct in her initial diagnosis. At the second appointment, before she was about to freeze the spot off on my leg like you would do with a wart, she had the roving dermatologist come in to take a look at my toenail and the spot on my calf. He took one look at the toenail, said it was a bruise. He then looked at my calf and quickly picked up the phone, booked me for an urgent biopsy appointment that day. 2 weeks later, I got the call that it was melanoma. Anyone here who has gotten that call likely understands when I say I heard nothing after they said the word melanoma. The dermatologist was saying things like excision and lymph node biopsy, and I couldn't comprehend any of these words. I was just immediately shocked and devastated. A few weeks later, after my wide excision and sentinel lymph node surgery, I was considered stage 3B. The same week that I was scheduling my surgery, the immunotherapy treatment ipilimumab, also called Yervoy, was FDA approved as an adjuvant treatment for melanoma patients that had lymph node involvement. I was one of the first patients outside of a clinical trial to use Yervoy to help prevent a recurrence. I was on Yervoy for about 10 months, and at close to the 1-year mark after diagnosis, after a PET CT scan and a fine needle biopsy, it showed the melanoma was back, and it had spread further up my lymphatic system to under my arm. I was officially considered stage 4. I then started on the combination immunotherapy treatment of Yervoy and Opdivo. This combination just happened to also be FDA approved the same year as my recurrence. A lot of things like this in my journey felt like strange moments of stars aligning at the right time. At the end of the second year of infusions, I had surgery to remove that last stubborn tumor in my armpit, and I've been no evidence of disease for almost 7 years now. I really want to highlight the lesson that I learned through my experience in advocating for my health and not settling for subpar healthcare. I was used to a system that only allowed primary care providers to spend no more than 5 minutes with a patient. They were overbooked, overworked, and were not provided adequate continued education and training on basic things like recognizing a suspicious skin lesion. The system they're in leads them to believe young, healthy individuals don't need as much attention and are not at risk of things like cancer. What I quickly learned after my diagnosis was that my situation was a textbook case. I checked all the boxes that should have indicated to my PCP at my first visit with her that I needed to see a dermatologist for further evaluation. I was a female between the ages of 25 and 29. I have fair skin and red hair, and I was also a female with a new skin lesion on my leg. Due to having such a poor experience with that provider and the misdiagnosis, I knew I needed to find a better primary care provider. So I did some research and I came across a company called One Medical. After my first visit with them, where my appointment was shockingly on time, and the primary care provider took a whole 30 minutes to get to know me as a human, I knew I was in safe hands. During my journey through treatment, scans, and biopsies, I felt like I needed to be a part of the healthcare system and give back in some way. And since I loved this new primary care practice so much, I decided to look into whether they were hiring. It's been almost 7 years now, and I'm still working for One Medical. I get to be a part of changing how primary care is delivered so that patients are part of a human-centered approach to care and are not treated as just another number to churn through, which is what creates so much room for life-changing errors like what happened to me. And one thing I know is incredibly helpful in making it through a diagnosis like this as a young adult is having a good support system and resources. I am grateful to have had an amazing personal support system throughout the whole process. My longtime partner was super helpful in looking into the best places for melanoma care, and we happen to live between two of the top medical facilities in the country, Stanford and UCSF. And I chose UCSF for their top melanoma oncologists, and I'll forever be grateful for that team. During the early days, right after my diagnosis, I came across the Melanoma Research Foundation website and their patient forum, and that online community helped me understand melanoma and made me feel a lot less alone during some of the hardest times of my life. As I became more versed in melanoma and its treatments, I wanted to be a part of this amazing community to give back to those newly diagnosed patients who were seeking answers and support the same way that I had. I contributed to the forum almost daily for my 2 years of treatment, and I still check in on the forum at least once or twice a year. Unfortunately, what I did not find during the years when I needed it most was in-person support groups for young adults with cancer, or even a general local melanoma support group. I was shocked that between UCSF and Stanford and all the other health systems around me, there were not more support groups available. They had plenty specifically for cancers like breast cancer and lung cancer, but I never did find a young adult or a melanoma support group in my area. The one time I found a general all cancers in-person support group evening, I went, but there was only one other patient that showed up, and they were about 30 years older than I was. So with that, I want to share my gratitude towards the Melanoma Research Foundation and thank them for partnering with an incredible organization called True North Checks. Last September, I was able to go on the first ever AYA retreat sponsored by the MRF in the beautiful Upper Peninsula of Michigan. And that's where I took the picture that you see behind me. I met 6 of the most amazing ladies there. I've never experienced anything like the instant connection we all had. Something about having been all young adults diagnosed with some form of melanoma created an immediate bond. Being able to relate about things like how a diagnosis like this affects your plans for the future as a young adult, such as a young woman myself who would have liked to think about starting a family earlier in my 30s, this diagnosis put any idea of that on pause for at least 5 years. So now I have to deal with the struggles that come with trying to get pregnant in my late 30s. Not something I ever thought I would have to think about. So I hope many more adolescent and young adult melanoma patients and survivors are able to experience the type of connection and bond that comes with meeting like-minded individuals with a shared experience, such as a melanoma diagnosis. That's my story.
Thank you so much, Jen, for sharing your story and what you're doing for other patients. By sharing your story, I know it's helping so many other adolescents and young adults who are going through similar things. And so I really appreciate you sharing. I will turn it over to Dr. Nelson, as I'm sure she has some questions.
Yes, absolutely. So let me just get my screen share back up here really quickly. Okay. So it's up, here we go. Okay. You guys can see. Does that look okay to everyone? Okay. So Jen, thank you so much for sharing your story and just sort of walking us through all the sort of starts and stops and misdirections in your journey to get the appropriate diagnosis and then to go through the treatment you received. I think it's really so interesting in hearing about how your first entry point with your diagnosis was your primary care provider. and how there was a true knowledge gap with them assessing not only your demographic risk for melanoma, but then also that individual tumor that turned out to be your melanoma. In the moment where that dermatologist was brought in, what was the interaction like between the dermatologist and your primary care provider? Was there any discussion about your tumor, about things that could have been detected?
I don't know if there was maybe discussion that occurred after I left. I feel like there maybe wasn't, because like I said, it was part of a health system that truly, they just did not have enough time for each individual patient, right? So when she had called the dermatologist in to take a look at my leg, she stepped out of the room. She wasn't even in the room when he was there with me. And then he picked up the phone, and when he was done, he kind of opened the door and found her down the hallway and said, she's going to go get a biopsy of this today. And that was the last time I ever saw that PCP. And we didn't really have much interaction after that.
We know that for primary care providers, whether they're family medicine or internal medicine, that there's very little teaching that happens during the residency programs about skin cancer detection. Within family medicine, there's a culture of training in dermoscopy or using the handheld magnifying glass that those of us who are melanoma nerds like myself, that we really love using because it helps us be more accurate in skin cancer detection. In family medicine, that's one of their core competencies for their residency training. And so that's amazing that there's interest in learning that content. There's not as much of a culture in that, looking in terms of that knowledge development for internal medicine trainees. And in the state of Texas, where there are huge areas of our state where there are just no dermatologists, we have been really successful in working with primary care providers to be able to teach them about melanoma detection. But the melanoma detection that we teach is really focused on the group of patients where it's the most prevalent, and that's in older gentlemen. And so thinking about your story and the appearance of your melanoma, it really highlights this need to make sure that all groups are included when we provide that instruction, that we're not only teaching about the older gentleman patient who may have melanoma, but then also pediatric patients and adolescent and young adults who may have melanoma. When you were talking about your systemic therapy, it sounded like the systemic therapy that you received was really, you were like just by the skin of your teeth standard of care for the systemic therapy that you needed. Was any of your systemic therapy in the context of clinical trials?
No, it's not in the context of clinical trials. It truly was, like I said, when I went on the adjuvant treatment for Yervoy, it had literally just been FDA approved the week that I was scheduling my surgery, which is just wild. And then when I had to go on the combination, it was all just through basic channels, not through clinical trial. And I was really grateful for that. The UCSF team was very involved in that. I think they were part of clinical trials when it was happening, so they were very familiar with the drugs and how they worked. So
that's wonderful that you were in the right place at the right time to get truly cutting edge care. With the other piece that your story really illustrates is that you were in a care setting where you were sort of learning how to advocate for yourself and understand what you needed and how to, if what you were receiving wasn't what you needed, to then seek what you needed. And how was that as an experience for you? Was that something that you'd had to do for yourself before?
No, I mean, this truly was the first time I'd ever had to question a doctor, was this right? Because like I said, the first appointment I had with her, I completely took her word for it. I mean, she's very confident in explaining what a seborrheic keratosis was, that it was a benign lesion. I even Googled it afterwards and I was like, oh yeah, those are ugly. That totally looks like that. So, when it turned out to be completely wrong, my world kind of flipped upside down, and I was like, okay, I realize now, obviously doctors are humans. We're all humans. Knowledge only goes so far, and in a lot of circumstances, it's not necessarily that specific provider is a bad provider. It's a part of a system that is not supporting them well enough to take care of their patients the way that they should be able to. So,
right. And
yeah.
also that they may have never really gotten much training in how to distinguish a seborrheic keratosis from a melanoma, especially in someone who's younger and fair complected. As you sort of acquire this new skill of advocating for yourself, were there others that you could talk to about what you had just experienced, or realizing that you didn't get the right diagnosis the first time and now you're in this big pickle? Like, were you able to talk to your friends and your family about that?
Yeah, I definitely reached out to friends and family and my partner, and we had, lots of discussion around it, and just it all kind of opened all of our eyes, right? And so yeah, this definitely helped. I was sharing my story with people I didn't even know that well, and I was telling them to tell their friends, and everyone just sort of like, go get your skin checked. This is like a real thing. And if you don't feel right about it, advocate for a dermatologist, advocate for what you feel is right for yourself. And through that process of being able to communicate that with a lot of different people throughout the years, I do know people who have since been diagnosed with melanoma, and they caught it early, and they've, sort of thanked me for sort of letting them know about my story and what I experienced. And so that's all I can really hope for from now on is to share my story, and hope that helps others sort of learn from what I went through so they don't have to go through that.
No, exactly. And I think that when you've been through something hard like this, there is an enormous sense of, you don't want to say purpose to all of the pain of your journey, but at least you can see, well, I can help others maybe avoid some portion of the burden that I've carried.
Yeah.
And when you're able to do that, it does help you sort of move forward with a sense that there's some good that has come out of this hard journey.
100%. I completely agree with that. It's definitely therapeutic and helpful selfishly to be able to share my story and hope that it helps others.
Absolutely. And it sounds like the ability to connect with others through the MRF forum was enormously helpful to you too.
Yeah, that was incredibly helpful. I'm just so grateful that that forum existed, because like I said, I wasn't coming across any local support groups or resources, which still kind of shocks me to this day. And so, yeah, I was on there daily, and I, made friends through there and learned so much. And, there's everyone from people that are veterans of melanoma who've been through it for 10 plus years, to, of course, everyday newbies going on there looking for answers and looking for help. And so, yeah, it's such a great place to go for support. And yeah, it was a huge support system for me.
And to just be able to be in a place where you can share things that are hard, things that are wonderful, but with people where you don't have to give all this huge backstory to your experience, that there's some degree of literacy about melanoma and where you are in that cancer care continuum, that ability to engage without having to explain all of that trajectory must have been something that really normalized you and your journey.
Definitely. Yes. Because while my friends are wonderful, my closest best friends, and they'll listen to me all day long, they haven't gone through it. So they don't, entirely know what it's like. So yeah, having those like-minded individuals out there to be able to connect with is really nice.
So, I think that when we think about the care of the cancer patient, because so many of our patients are older, family planning, fertility preservation, those things often aren't at the top of our to-do list when we are caring for patients who have progressive disease. Have you been able to find a community in that space as well, in terms of your now journey to move towards building your family?
I haven't. And yeah, it's been kind of an interesting journey now looking back at were there things I could have done to, preserve? Should I have frozen eggs? I have no idea. It didn't really come up. It was at the time, of course, all I was thinking about was get this melanoma out of my body and
Of
let me
course.
move on with life. I mean, I
Right.
do recall asking my oncologist at the time, like, do we think that these treatments, these immunotherapy treatments, which, like I said, were brand new to the market, really outside of clinical trial, is there any concern? And there was no, general concern, just the way that they work, that they shouldn't have any effect on my reproductive system, and I don't believe it has. But because of having to wait so long to sort of start the process, just naturally, it is
Right.
harder when you're a little bit older after that age of 35, that sort of hump in the road as a woman.
Yeah.
Things just get a little tougher. So yeah, I haven't really found that sort of support in that realm
Yeah.
just yet.
Well, I think it's hard too because people don't talk about infertility,
Yeah.
much less infertility in the space of being a cancer survivor who's
Yes.
gone through the journey that you've been through. And so it is hard to find support in that space, much less support specific to the journey that you've gone through. Because, even in our day and age, there's still a sense that it's not something that people talk about. And
Right.
that makes it so isolating. And that's, I think, a real sort of unmet need and opportunity, not only to make sure that patients who are diagnosed, let's be truthful here, women who are diagnosed with melanoma in their 20s, that they have really specific resources available to them to understand what are the different ways you can build your family, what are things you can do now if you want to, what are things you can do later if you're having challenges,
Yeah.
and the need for just a really frank understanding of what all that means.
Absolutely.
Yeah, it was a science fair project to start our family. And so, I feel you that it's just a really lonely place to be when
Mhm.
you're trying to do it. And so I feel you. That's a tough area, whether it's, within the cancer space or not, that there's
Right.
just a need for a lot more resources. Yeah. Well, I think, Ryan, have we had any questions come through on the Q&A?
Yes, so I will start with so Dr. Nelson, as a dermatologist, what is your messaging around the importance of annual skin checks for the AYA community, and how do you think the MRF can support that mission?
Right. So I think that there's enormous value to being aware of your own skin and to having a dermatologist who you trust to do high quality skin checks. I think that there's also value to looking at individual risk, and there's a fine balance between wanting to make sure that patients don't receive unnecessary biopsies, but that they also have access to high quality diagnostic care. So for patients who are high risk, whether they've had other types of cancer, whether they have a strong family history of cancer, very fair complected skin, all those things are reasons why someone who's in the sort of AYA age range would want to make sure that they could get a really good skin examination with a board certified dermatologist who uses a dermatoscope and uses it in every skin check exam.
Thank you. Let's see. So Jen, how did you navigate existing and new relationships, like during your diagnosis and then now?
Yeah. So I definitely feel extremely grateful that I had a longtime partner when this happened. And we're still together and spent 16 years, which is just wild to think about. But I cannot truly imagine how hard that is. I know, we have friends, and I've talked to other melanoma survivors and patients who were single when it happened, and then you're trying to date and meet people because you're a young adult, and that's just a part of young adult life, right? And it's an interesting thing to have to navigate and figure out, like, do I tell them on the first date? Like, what do I do? So I'm really grateful I didn't have to go through that and navigate that myself. I have wonderful friends that were very supportive of me. Certainly there's extended sort of acquaintances and people that when they find out, they maybe throw their 2 cents in a bucket, give you all their interesting point of views on naturopathic medicine and whatnot. Anyone that's had a cancer diagnosis completely understands what I'm talking about. And you just learn to tune them out and just know that they're not your true friends, but your good friends will always stand by you and support anything that you're going through, and any treatment decision you make. But yeah, it's definitely an interesting, it's interesting to go through. I'll say during treatment, obviously going in for infusions at the infusion center all the time. And you're sitting there for hours on end, and sometimes your appointments sync up with other patients around you. So you're kind of always there at the same time. I was never there when there was somebody even remotely near my age. And this is an infusion center where obviously they're seeing more than melanoma patients, but the folks I clicked with were folks that were melanoma patients, but they happened to all be at least 60 or older. And they were lovely and so kind, and we had great conversations. But it was really interesting to really sit there and think, like, oh my gosh, I look like a baby compared to everybody else sitting in this room right now. It's a little bit strange and kind of isolating at the same time.
Thanks, Jen. And then this is a question for both Dr. Nelson and Jen. And so how do you think the MRF, how can the MRF provide more resources to the AYA community to learn about melanoma and find support with other AYA patients, survivors, caregivers?
Jen, do you want to do that one first and then I'll talk?
Sure. Yeah, I mean, the MRF is already making strides in connecting with other organizations like True North Treks. And so I think that is just a wonderful way to really continue to spread their wings and connect with other organizations that are existing that are already helping that group, the AYA group, right? And learning from them and learning, how do you find those group of individuals that need this resource? Where do we put the resources for them to even find? And in this day and age, we're just Googling everything. So how do you make it come up when you're Googling, I don't know, young adult cancer or, melanoma age 28, like just, thinking about things like that. That's how people are finding resources these days, right? Young people anyway. We're on our phones and we're looking it up. And then having really great information and links and support online that they can navigate through. Yeah.
I think how people are accessing healthcare information has changed dramatically, especially with this age group, with TikTok being a source where people are trying to learn about healthcare topics. And when you look at what's on TikTok, there aren't many board certified dermatologists on there. There are a lot of other people talking about all sorts of different things with skincare, certainly, but also people who aren't experts talking about skin cancer and what reduces your risk or what is acceptable for treatment. And so I think within the realms where young people are looking for information, making sure that the information is there to be found is an enormous opportunity. So I think that that's something where there's, it's worth making sure that we know if you're on TikTok and you're typing in, melanoma, or you're trying to search for pictures of melanoma, what are you going to be seeing? And is that what we want patients to find? So I think that that's something that's an opportunity in terms of making sure high quality information is available, but then also making sure people understand how they can link to others and find good resources for finding others for that sense of community.
Thank you, guys. Let's see. Another question. I guess for either of you, what do you think is different about receiving a cancer diagnosis as an adolescent and young adult versus other ages, which I know, Dr. Nelson, you had mentioned a little bit earlier in your PowerPoint, but just touching on what is different between a cancer diagnosis at an AYA age versus an older age?
Yeah, I think that, within my practice here at MD Anderson, I have the privilege of caring for truly people of all ages with melanoma, children, adolescents, young adults, older adults, all the way. One of my patients who I saw today was 98 years old, which is amazing. And when you receive a cancer diagnosis in your 40s or 50s, if you're a functional adult, you're used to being sort of handed news you don't really like, recognizing that you have to do things and that you have responsibility for following up. When you receive that diagnosis when you're 15, 16, 17, 18, 19, you haven't necessarily had to practice that skill before. And if you're still living at home, your experience is very different than if you are now in college or if you're just newly on your own. And then if you are receiving that diagnosis when you're still at home, how do you navigate the transition when all of a sudden you are on your own and you're the one who's having to make sure that your follow-up appointment is scheduled when you can come in? And that's an entirely new skill set for someone to learn in the context of having a cancer diagnosis. So I think that's a very meaningful difference just in terms of what skills do you have with dealing with news that you don't want and setting up the details of what needs to happen next.
Yeah, I completely agree with all of that. It's definitely, for myself, when I was diagnosed, I was supporting myself. I'd been living on my own for quite some time. I was also just starting school again. And so there's a lot of things to navigate in having to work full time, go to school full time, and then, oh, by the way, you're going to be a patient full time too, because now you have cancer. And how do you navigate all of that while still being able to pay your bills? And you're not quite, at the age where you've made it in your career and you can afford to take a lot of time off and you have a lot of PTO and you have all the stuff. Like, it's an added stress that you definitely don't see coming, and yeah, you're not prepared for. You've never dealt with anything like that before. It was the first sort of big medical diagnosis I'd ever had in my life. Previous to that, I was just a healthy young person. I didn't have anything to really worry about. I didn't even necessarily go in for annual physicals every year because I just didn't find it necessary in my 20s. So yeah, it's very different, I'd say, than being an older, more established person, or even a child who has, their parents there to support them through it. Yeah.
Thank you. Jenn, so with your initial diagnosis or misdiagnosis, if you hadn't advocated for yourself, what was the plan for the treatment of what they originally thought?
So originally, when they thought it was a benign skin lesion, if I hadn't gone back 6 months later, I very much would not be sitting here in front of you today. I would not be here. So I think about that often enough to keep myself in check in life, right? But yeah, because it's seborrheic keratosis, it's a benign skin lesion. There's not really anything you need to do. You can, what the doctor was going to do, freeze it off like you kind of do with a wart because it's ugly. It's more of a vanity thing, but it's not something that's dangerous and would need treatment necessarily. So if I had not gone back, and I always sort of blame the mysterious bruise on my toenail for getting me back into the doctor's office, things would be very different for sure.
Thank you, Jen. Another question for you. How vital has it been for you? And I know that you mentioned it a little bit when you were speaking, but has it been to connect to other AYA melanoma patients? And what ways have you done that? And I know that you mentioned the Trek, but if you want to talk a little bit more about that, or is there any other ways that were vital in connecting with other AYA patients?
Yeah, I mean, I definitely utilize the Stupid Cancer Foundation online forum every once in a while because that was sort of like the one place I found online that I knew for sure was AYA geared. And I didn't use it as often as I did the Melanoma Research Forum because I was really looking for those that really understood melanoma, and it's such a unique cancer. And the treatments were so new, and so it was like it was really great to connect with people directly that really understood the sort of treatment pathway and all the side effects and things that come with that. But when I saw, on Instagram, of course, we're talking about social media and how people find information. It was Instagram where I found that the Melanoma Research Foundation was partnering with True North Trex. And I jumped at the chance. I don't know if I was like the first person to apply, but I feel like I was because like I immediately was like, I've been looking for this for years. I want to meet others in person and connect. And I'm so glad that I did. Like truly, the minute we landed and got on a bus together, it was like we'd all known each other for a million years. Like we were immediately sisters. It was wild. I've never, ever in my life had an experience where I connected with people so fast and felt so comfortable. And it was just so heartwarming and truly something that I think everyone who goes through an experience like a cancer diagnosis, and especially as a young adult, should experience that type of connection and that type of bond that comes with just being able to be in person, even for a couple of days with people who have a shared experience like that.
Yeah, Jen, you bring up a good point. I think for uh, especially in the young adolescent and young adult space, connection is so important and vital. And I think that's like another thing maybe that's a little bit different than like older ages, like mentioned that they are established. And young adults, we crave that connection with other people, and it's so important. And so when you find someone online, it's great, but then when you see them in person, it's even better. The connection is, like you said, amazing, and it's instant, and you just know that person totally understands the diagnosis. So thank you. And then I have one last question, which I do feel like we've touched on a little bit in several different parts, but just what are some of the disparities have we seen missing in the AYA community for support and resources versus other age groups who may have more resources or support? And so I think that's a good question to kind of like just wrap it up a little bit. And so Jen or Dr. Nelson, or both, you guys can both speak on that.
Yeah, I think that, where we need to better understand for AYA patients and melanoma is, what parts of your journey worked well, what parts didn't. And then to really start identifying resources that we can develop to try to, make those hard parts a little bit easier. And hearing Jen's story certainly highlights a lot of components around receiving accurate diagnosis, around sort of advocating for yourself. So and then navigating being in school and working when you still need to have access to medical care. So I think there are a lot more stories like Jen's that as we gather those stories together and look for themes and trends, we can start building the sort of roadmap for our AYA melanoma patients and where we really need to develop resources to help them.
I completely agree. I think, now that I work in the primary care space and I have a very good understanding that patients come in with everything under the sun for their PCP, as they should. Their PCP is their first line healthcare provider. So I am very much an advocate for educating PCPs around the country, everywhere, about all things dermatology, but especially about being able to just recognize the basic signs of when a patient should just really get referred to dermatology and have that closer look.
Thanks, Jen. So I just want to kind of wrap up a little bit. First, just Dr. Nelson has the resources up on the screen. This is not all of the resources for the AYA community. There is many more, just highlighting some of them to look up. And then, so with that, I just want to thank again, Jen and Dr. Nelson for being a part of the Ask the Expert session. Thank you for joining us, and we appreciate all that you do for the melanoma community and appreciate you taking your time, additional time to be with us this evening. And then I would like to just highlight too, this program will be available on demand on our learning platform and also streamed to our social media channels at a later date. At the end of the program, when you close Zoom, there will be a short evaluation that'll pop up on your browser. Please fill that out. It's so important and it helps provide us with feedback on today's session and helps us create new programs for the future. We want to ensure that we're creating new programs based off of what patients, caregivers, survivors want. Please visit melanoma.org to learn more about our upcoming webinars and other other educational or advocacy opportunities. We have a ton of free resources that we offer to patients, caregivers, and healthcare providers, which includes educational literature, a patient forum, Ask the Nurse email, and animated patient video series. And if you guys have any questions that you can think of later, you can email us at education@melanoma.org. I again want to thank our speakers and thank you all for joining us. And I hope that you have a great rest of your day.